Hello and welcome everyone. I'm Julia Kielbeck. I'm a third-year medical student training at Bastyr University in Seattle, Washington. I'm studying naturopathic medicine and acupuncture. Bastyr is a four-year doctorate program with medical training for primary care physicians. I serve as the secretary of NMSA. NMSA is the Naturopathic Medical Student Association at Bastyr University. We are a student organization through Student Council, and we are connected to NMSA International. And NMSA International has 9 chapters across North America. And we are excited today to host Dr. Tony Nader as he shares his wisdom on neurology and consciousness and its role in overall health and well-being. And I'd like to turn it over to the lovely Dr. Biscotta, who has helped us coordinate this event today.
Welcome, everyone. I'm Dr. Sudhi Vescoda, adjunct faculty at the Teaching Clinic of Bastyr University. As Julie already described, for those who are not familiar with Bastyr University, it is a 4-year naturopathic medical school that trains physicians in various natural medicine modalities, as well as primary care. Few housekeeping points. Please keep your mics muted, but you may keep your cameras on. Feel free to type your questions in the chat. They will be addressed after the presentation. We will have 25 minutes of presentation and 20 minutes for Q&A and discussions. From Bastyr community, we would like to extend our warm welcome to Dr. Tony Nader to talk about role of neurology and consciousness in overall health and well-being. Dr. Nader is physician trained at Harvard University and MIT with a PhD in neuroscience. His training include internal medicine, psychiatry, and neurology. Dr. Nader's research include neurochemistry, neuroendocrinology, the relationship between diet, age, behavior, mood, seasonal influences, neurotransmitter, and hormonal activity. His writings include the relationship between mind, body, consciousness, and physiology. Dr. Nader's new book, One Unbounded Ocean of Consciousness, has been published as an ebook by Penguin Random House. Paper copy is also available. Please sign up via the link in the chat to get a free ebook. Now, without further ado, please everyone join me in welcoming Dr. Nader.
Thank you, Dr. Biscotta. Thank you, Julia. Wonderful to be with all of you. It's a very interesting topic in terms of mind-body coordination, mind-body relationship. And it's a joy to be addressing those who are interested in the most natural way to heal and create wholeness and well-being from the components that nature offers us and from different approaches of diet and mind, body, and other aspects. We know the mind plays a very important role in our decision-making in our life because it is through the mind that we make plans, that we experience things through feelings, etc. And therefore, it's something very profound in our life. It has usually been left as part of philosophy or psychology in general. Before psychology became a true science, it was just on the level of feelings and mood and ideas. And today we have a very profound understanding of the relationship between mind and body to the extent that we know that they are intimately related, and what happens in the mind has an effect on the physiology, and what happens in the physiology can have a profound effect on the mind. Consciousness is actually a more basic, if you like, more primary than just the mind. The mind, when we think about it, it's that aspect which carries thoughts, which carries experience of feelings. But all of this happens in our awareness, in our consciousness. So we can be conscious, awake in a clear way. We can be sleeping where there is no consciousness, yet the body responds to environmental factors. We can be in a dream state where we are aware of illusionary reality, not the real reality. And even during wakeful consciousness, we can have dullness, clarity, profound experience of peace inside and clarity of thinking and ability to make the right decisions is more because we are not disturbed by stress. And so in recent years, scientists have been studying what consciousness is. Because without consciousness, we cannot plan, we cannot dream, we cannot love, we cannot experience anything. We are like robots or automatons, that react like that, to things in a way that is like a machine. And as human beings, we want to take control of our life and make decisions and do the best we can. And for this, we have to be conscious. So as a definition, consciousness is simply the ability to be awake, the ability to be aware, the ability to respond to things. And it can extend not only to human consciousness, but also to animal consciousness. Even we can take it to further into all the fields of life. And if we look at it from a most primordial level, it extends to very basic even level of existence. But I will not be discussing this right now. It is all discussed in great lengths in this book that was announced, One Unbounded Ocean of Consciousness. Let us have a peek into consciousness and its relation to the mind and to the brain, and that leads us to the relation to the physiology, to health and well-being. I will be sharing some slides so that we can have a pictorial view of what we're talking about. So let me launch this. I'll share my screen now. So that's the title. Consciousness, we can call it the screen in the movie of life, which means if life is like a movie that's going on, there is a screen that is allowing that to happen, that is allowing us to see the movie. Without the screen, without that consciousness, we are not able to perceive anything, experience anything, or be the humans that we are. Consciousness has been defined in many ways. There are many terms that connect to consciousness: wakefulness, awareness, alertness, attention, vigilance, and focus. It is different from what we call conscience. Conscience is a moral aspect of our awareness, where we feel morality and good action and what to do and not to do. It is not what we're talking about. That conscience is part of consciousness in a sense, because we have to be conscious in order to be conscientious, but it is different. So we're talking about the ability to be awake, to be alert, to be aware. And these are different terms, but also they have different meanings. In the nervous system, the substrates of consciousness, which means what is it in the nervous system that holds consciousness together, or allows it, or at least apparently seems to hold it in the nervous system? It's our nervous system. Of course, it's the brain, and in particular, the higher parts of the brain, which we call the cortical areas. There are associative regions. There is a part which plays an important role in the middle of the nervous system. It's called the thalamus. And there are areas that are lower in the nervous system, the subcortical areas, and even lower in the brainstem that we call the reticular formation. You can see here that this is the brain. The cortical areas are on top of the brain. This is the structure that covers the brain. And here are the different sensory inputs, like from the ears, from the eye, from touch, from feeling of pain and temperature receptors. And they are channeled through the spinal cord into an area they pass by that area. They're not channeled directly there, where there is the reticular formation in the base of the brain. And then they go to the thalamus generally, these sensory things, and then are distributed to the higher parts of the nervous system, where we are conscious of having the experience of pain or touch or sound or whatever, memory, etc. The reticular formation is an area that modulates wakefulness, which means how aware you are, how awake you are. Therefore, it is part of modulating the strengths of awareness. And the upper parts are those areas where the content of awareness is analyzed. And all these association areas that connect right and left are like the fibers that connect the different processors in the brain, the processors that actually are working to analyze things from a vision perspective, from a hearing perspective, from frontal areas, for example, here, that analyze the future, compare it to the past. It's the kind of CEO, the chief executive officer of the brain, conducting the affairs of our life, making decisions, and anticipating the future. These are areas in the cortex that lead to simple sensory perceptions, and you, as studying a field of health, you are very aware of this. So consciousness has these aspects where we have information processing that happens on the conscious level, which means in these upper parts of the brain, but they also happen in subconscious level where we learn things through imitation, for example, through repeated practice, and they get in our nervous system in a subconscious way. It's like driving your car or your bicycle or doing some automatic work. It becomes part of what you have learned, and you don't even have to be very conscious of it when you're riding a bicycle, of every little move that you do. So that is an aspect also that talks to consciousness, but from a more implicit level. The unconscious are values that are very deep. They can be due to stress or strain or very deep aspects within the nervous system that are there influencing our life and behavior, but we kind of almost cannot access them or very rarely can access them. So actual consciousness is something that relates to our intentions, our wishes, desires, emotions, thinking, imagining, planning, and perceiving. And also there is what we call a background consciousness, which is the color of consciousness that is the self, our identity, who we are, our name, our origin, our nationality, how we identify ourselves. So there is this background consciousness, which is not active. We don't always remember, I am such and such, this is my profession, and I am this and that, and I'm married, or I'm single, I have children, I am the son of this or daughter of that, and like that. These are are in consciousness, but as a background that are our self. So the idea of self, therefore, has different levels. There is the proto-self, which is being localized more or less in specific areas, which is the basic body functions. And therefore, we can say there is an awareness of what is happening in the physiology. But this awareness doesn't go up to the nervous system, to the brain fully. I mean, it goes from the nervous system, but doesn't go up to the higher parts so that we're aware of it. So you're not aware of your heart rate, you're not aware of your metabolism, you're not aware of how much sugar you have in the blood. And that is kind of still aware. Still, the nervous system is monitoring these aspects. There is the core self, which is the visceral activities and emotions. And these are things you are aware of, but they are also kind of a little bit on the background, because if you're sad, when you put your attention on it, you feel it and you experience it. And there are areas in the nervous system, the midbrain and the amygdala, that have been shown to have connections with these aspects. The other aspects, which is the autobiographical self, is mostly in the upper cortex of the brain. This is where language, speech, and memory, and the things that you're really, truly aware of and you consider part of your wakeful state are present. Now, where does consciousness come from? there is an easy problem in consciousness, and that is how to trace, for example, if you touch something that is hot, it activates the receptors in the finger, let's say, and then we know that there is a type of cell, nerve cells, the CC fibers, that conduct this in the nervous system to the brain, and then somewhere it makes you feel there is a place in the nervous system where the sensory input comes. So that we have analysis of this. It's called the easy problem, even though it's very, very difficult problem, like how we understand words, how we hear things, how we smell, how the sense of smell comes, how we appreciate things. It's very difficult problem, but it's being resolved, and it's called easy problem because we figure out that one day we're gonna discover that. We're gonna discover how this happens. There is the hard problem of consciousness, which is how do we actually experience as a conscious human being pain, or how do we experience sadness? And we say, I have sadness and I'm conscious of being sad, and it gives me an experience, and I'm conscious of myself and all these other aspects of consciousness. There are many theories in this, and none of them comes even close to understanding really where this hard problem is. And that's why it is considered a very hard problem, because we have, even if we go to quantum mechanics and quantum field theories, which are the finer levels of activity of matter, or the origin of the physical reality rather than matter, still there is no way to explain this value. Again, this is One Unbounded Ocean of Consciousness, is the book that actually goes in great detail to explain where consciousness is, where does it come from, and how actually it plays a very primary role in life and living in relation to our planning, thinking, behaving, etc. So that details it. I will not go through those details because it's quite a lengthy process. I'll go through some main points about consciousness. There are usual states of consciousness. People call them normally normal states of consciousness. I'd rather call them usual because these are the ones we are familiar with. It doesn't mean that other states of consciousness are not normal. There can be other states which are even more normal, but the usual ones are waking, where you're active and awake and aware, dreaming, where the body gets very active because there are things that are changing. But the consciousness is not aware of a real reality. It's aware of a dream, which is an illusionary reality. REM stands for rapid eye movement, because when you're dreaming, the eyes move very fast. It's how it works. And deep sleep is when you are deeply asleep, rested, but no awareness at all. And it is not a rapid eye movement state of consciousness. Now, there are impaired states of consciousness, and this is where doctors will meet with these neurological factors, where they happen in psychosis, delusions, hallucinations. This is usually in the field of psychiatry, because apparently, as if nothing is wrong with the nervous system, but the connectedness inside the nervous system, the neurotransmitters, and the electrical activity lead to hallucinations and psychosis that are not normal in terms of reality. There are other states, locked-in syndrome, where one is awake, but the body cannot be controlled. And there are other states, minimally conscious vegetative state and going into coma, where we lose the higher functioning. We're not aware of anything. And we are still alive, of course, and there is still some activity in the nervous system, but we are really not responsive to stimuli, so we are very less in touch with the environment. There are altered states of consciousness, and these are, again, happening sometimes with damage, sometimes with drugs, dissociative states, hallucinogens, lucid dreams, sleepwalking, hypnosis, and anesthesia are altered states of consciousness, which means they have been changed by some mechanism, either drugs or through injury. Now, these states of consciousness, we can look at them. Here we see in this chart on this side, awareness of the environment. And this is the level of arousal. So we can be very awake, but have no content in the awareness or very little awareness, or we can be aware of the environment and have, on the other hand, sometimes low level of arousal. So these combinations are possible. And this is where you can see all these areas described, like a vegetative state, for example. A person has quite a high level of arousal, which means if you pinch them, they'll react to it, but they have no awareness of the environment. And like this, you go up into these scales, and you can see that we have all these states. Now, there is something which is here, is called higher states of consciousness, which we will discuss today also, where you have high arousal and high awakening, high environmental alertness, but can also have high arousal, which means high awakefulness, with actually no content in awareness. So that is a very unusual state, which is very, very important and has been shown, as we will see, to lead to very positive, powerful effects on health and healing. This is another way to present the chart. And we can tell that if you analyze the blood flow, for example, to the nervous system, to different parts of the nervous system, we can see that different states have different blood flow and different distribution of blood in the brain. Of course, when brain is dead, there is zero, it's all black. And normal consciousness, normal wakefulness is more alert. And then you have all these other dimensions. That means the nervous system is in touch with consciousness. What is consciousness? And here is something that shows in red the increased in blood flow, as we said, to the frontal part of the brain, in a special technique which is called Transcendental meditation, where the person closes the eyes, sits easily, comfortably, and learns this technique that allows the mind to settle down. And here is the experience of wakefulness by itself without content. So there is experiencing oneself, one's own consciousness, without a specific content of consciousness. So it's consciousness experiencing itself. And this has been called in ancient tradition, be it in Japan, like nirvana, or in the Vedic tradition as the state of samadhi, which means a state of full awake inside. And it has been shown that when people practice these techniques, there is a very high blood flow in the frontal cortex, which is therefore great alertness, and this is the executive part of the brain. Now, transcending, which is through this transcendental technique, has been shown to be a hypometabolic physiological state, which means a state in which the body is very, very deeply rested. As you can see, all these indicators of rest are there, very significant as compared to control. For example, respiration rate is reduced significantly because the body is very rested. The basal skin response is improved tremendously compared to controls. And even as the oxygen rate is reduced, the lactate level is also reduced. So it doesn't show that it's a hypoxic state, which means low oxygen, therefore you have more lactate because you are preventing the body from functioning properly. That means the reduction in oxygen consumption is the result of reduction in the need of the body, and that means there is a very, very deep rest in the physiology. When your muscles are rested and you are relaxed, you are less in demand of oxygen, and your metabolism is very effective and efficient. Whereas if you stop breathing, for example, you immediately have a higher lactate in the body, which also happens in stress, We also have changes that have been shown with transcendental meditation in the nervous system that indicate the connectedness between mind and physiology. Again, this is the part of the brain where we have conscious planning, executive functions, the sense of self, abstract thinking, decision-making are happening in these areas. And stress reduction has been shown to reduce stress actually itself, has been shown to reduce blood flow and oxygen to the prefrontal cortex and causes it to go offline in a sense. And the reason is the nervous system has that tendency during stress to focus on the stressful event and to shut off the connectedness to the higher parts of the brain. So under stress, you use very low capacity of your total nervous system, which has, as we said, like a computer, many, many processors. And so they are kind of said as if the nervous system tells them, oh, we don't need you right now. I need to deal with this stress. And therefore, I'm going to shut down my support to you, and I'm going to be just working on my little stress. And that's how stress leads to a reduction in blood flow to these areas, whereas the practice of transcendental meditation has been shown to increase blood flow, as we just saw, to the prefrontal cortex and increase coherent activity between the different parts of the brain. So what is transcendental meditation? A very simple technique. You sit easily, comfortably in a chair. If the mind is like an ocean, and the thoughts are like bubbles coming from the deep depths of the ocean. As you go deeper, it gets more and more quiet. It's active on its surface, the ocean, but on the depths of it, it is very, very quiet and very simple, that if you go to that area, the mind settles down. And that's how we have seen that when the mind settles down, the body also settles down, and that is how you gain deep rest. So there is a technique that you can learn that produces this. So this is the conscious active thinking level, and this is pure consciousness, which is the thought of source of creativity, and transcending means to go there. Now, this has been compared to different techniques, and each technique has its own electroencephalographic signature, which means the electricity of the brain is having different wavelengths and different frequency. In focused attention, it's in the gamma region, which is 20 to 50 hertz. In open monitoring, which is usually mindfulness and such techniques, it's more in the theta region. And in transcending is in the alpha region, alpha 1 in particular, 8 to 10 hertz, which has been shown to be very significantly correlated with different values of creativity and thinking, as we shall see. I'll show you a small video that shows how it happens during transcending, what happens. And so it's just about 1.5 minutes.
Upgrading the executive brain.
Can you hear?
Brain coherence through transcendental meditation.
Yes.
What you are seeing here is the computer screen of the EEG being recorded from an individual with their eyes open before they meditate. Let's pause and describe what you're looking at. There are 3 blue zones and white EEG tracings. The top tracing is the left frontal EEG amplitude or local coherence. The middle tracing is the right frontal EEG amplitude or local coherence. The bottom and most important graph is the computer calculation of the relationship between the left and the right frontal regions of the brain. And this is calculated on a scale of 0 to 100% coherence or brain orderliness. When the white line reaches the top of the blue area, that means maximum brain coherence or maximum brain orderliness. When it goes to the bottom, minimal brain orderliness. In a moment, the individual will be asked to close their eyes and begin this simple practice. And then we'll see what happens. You can see now with the start of TM, within a half a second or so, the individual brain becomes maximally orderly. This is extraordinary, to have orderliness coherent above 90%. and this coherence is sustained throughout the practice. This is unique in the sense that the normal range of coherence in the population is 30 or 40%. So we're training the brain to be more and more orderly through sustained high levels of brain coherence. This experience, repeated during daily practice of meditation, trains the brain to order. This training the brain to order, this unique experience of maximum network orderliness, underlies the many documented benefits of this simple, effortless practice.
So there are different studies that have shown the importance of this coherence on, for example, attention deficit disorders, hyperactivity disorders, and their relation to the brain between control groups and people who practice transcendental meditation, and many other related benefits of this alpha EEG coherence, which in fact what it does, it tells us that the whole nervous system is now working together. So all the processors that are in the upper parts of the nervous system align themselves to give the best possible analysis of the situation and the deepest possible way to integrate the functioning of the physiology from different areas or different perspectives. And so we've seen this, and it has been shown significantly to reduce anxiety, depression, increase emotional intelligence, and ability to perceive stress in a way that is more holistic, more comprehensive, more able to be on top of stress rather than be overwhelmed by stress. It improves interpersonal relationships and happiness, and reduces trait anxiety. And it has been compared to many other techniques, including biofeedback, different educational techniques, concentration techniques, relaxation response. And we see that transcendental meditation, for example, in this case, it's a meta-analysis, which means many studies have been put together that shows much more significant effect size for those who practice transcending. This leads through the neuroendocrine axis to a change in the hormones, of course, all the body also. And here we see as important stress hormone, cortisol, how it reduces during the practice and remains low after the practice. So this practice, the simple, easy, natural, and that is very important. It's a natural technique. So for naturopaths, this must be very important, so that it's not a manipulation or trying to do something unnatural, but just allowing the mind to naturally settle down. It's very easy, and it's really coming back to nature. It's coming back to our original design and allowing our life to be lived and our nervous system to be working properly, using all of its reserves, and it leads to these benefits that you see now on the screen. On the negative sides reducing, and the positive sides on the right side all improving. And this has an effect on health. It has been shown to reduce blood pressure, heart disease, diabetes, headaches, and improves biological longevity, so reduces biological aging, and it increases strength, energy, and longevity. In blood pressure, it has also been compared to many other techniques and has been shown significantly to be better than others in many different studies that have been conducted. And one can ask, so what is the ultimate outcome? Well, interestingly, it's longer longevity, it's greater survival. In this case, for heart attack and stroke, a 5-year study has shown that those who practice transcendental meditation have 48% lower rate of attacks, heart attacks, strokes, and even death. So it has a very real effect, and this is how we see acting from the level of consciousness, because transcendental meditation is not a physical technique, it's a mental technique. We can have profound effects on all aspects of physiology. We have reviewed some of these as we looked at them in summary, And you can also look at the endpoint products as reduction in hospital admission in every category. And even on the expense level, we can see here people who have been followed up for many, many years starting. We have two groups here that we started. And then when they started TM, this is how they physician expenses for people over age 65 have reduced. So here is a line of those who are not practicing transcendental meditation. And that is an indication that these people who practice TM need less medical care and are much more effective in their life and need less attention. So this is basically a summary. I took a little longer, but it was good to share with you the slideshow. I'll stop sharing and come back to you. So this is a general presentation, and I have some questions already. Should I take them that have been sent to me, or you want to ask directly questions?
Hi, Dr. Nader. There's a question that came in about drug use and experiences with drugs and what your feeling is on that.
Drugs are an artificial way. So, of course, I'm sure the naturopaths would not want that. Particularly, I mean the drugs that are hallucinogens, psychedelics, and recreational drugs. They act on the chemistry of the nervous system, and they change the electrical chemical activity in a way that is like creating a storm, and therefore you can have some flash of experiences, but they are very unnatural, and they lead to habituation, to the need to increase the dose, and ultimately to dependency and very dangerous side effects. So there is, of course, no indication to take them like that. So better practice something natural and easy and without side effects.
Thank you.
Yes, go ahead.
No, please go ahead with your questions, Dr. Nader.
There is a question, can you experience consciousness without meditating? Yes, consciousness is what we are, what we experience. It is the fact of being conscious. Consciousness is not an object out there. It's really who we are. It's our awareness. It's what allows us to be conscious. So when you are awake, when you're listening to a lecture, when you're feeling something, all of these things, because you ask, can you give examples, are colors of consciousness. So consciousness, when it's colored with joy, you can feel happiness. When it's colored with sorrow or sadness, you can feel maybe sad, you can feel depressed. When it's colored with fear, you can feel anxiety. When it's colored with joy and hope, then you can feel you are planning and wanting to do. When it is broad and clear and you are rested, you feel good, you feel your eyes are open, you enjoy the aspects of life. So consciousness is that screen which is with us, which allows us to experience totality and reality. And in fact, it is actually ultimately the essence. It is the source of all that is material and the most significant aspect of our life. Because imagine without consciousness, if you are in anesthesia, for example, you can have surgery, your body is being practically tortured or, in a surface level. Of course, it is for good reason to remove a disease or adjust something, but the body is going through strain and you don't feel anything. So what is the meaning of wealth, love, happiness, growth, development without consciousness? It has no meaning. So consciousness is all permeating.
Dr. Nader,
yes?
Morgan Kelly has a question. Morgan asks, is there any research on transcendental meditation in practitioners and reduced rates of Alzheimer's or Parkinson's?
There is a very important study and follow-up in Parkinson's disease where it shows that during transcendental meditation and remaining after, all the shakiness and the instability and rigidity of the limbs reduces. And that is because there is a greater control from the upper parts of the brain and improvement in the secretion of dopamine, etc., and the proper places that happens naturally. Our body is a pharmacy in itself, and it has all the endorphins, all the dopamines, etc., but some of them get improperly functioning, and it is possible through consciousness to contribute. There are no studies specifically on Alzheimer's disease, but meditation does improve memory in general and improve ability to think clearly and make right decisions. We have not done specifically research on Alzheimer's disease.
Great, thank you. And one more, please. Holly Donaldson wants to know, what are examples of the higher states of consciousness referenced in the upper right-hand corner of the chart on arousal versus awareness?
Yeah, this is a very good question. See, we talked about 3 usual states of consciousness: sleep, dream, and waking, and they have their own characteristics of brain waves and physiological functioning, and also experience on the mental level, which means either you are not conscious of the environment, you are conscious of an illusion during dream, and you are conscious of the waking state of the outer environment. And scientists have discovered that when you practice transcendental meditation, which means you go beyond the surface level of consciousness and dive within yourself, you experience a state that is unusual because it is extremely restful, powerfully restful, yet you are awake. And you are awake on wakefulness itself. So that is we call transcendental consciousness, and that is experienced as pure awareness, pure consciousness. You are experiencing consciousness itself, which means the source of all the other aspects of consciousness. Consciousness without the color of feeling, or without thought, without impressions, without expectations, without anything, is pure consciousness. And usually we don't experience that in the normal waking state. But through transcendental meditation, you transcend, which means you go beyond those surface values. As you remember the waves in the ocean, you go to the depths of the ocean, and there it is quiet, silent, but it's not asleep. It's very alert. And in fact, the reaction time is much more efficient. So reaction time to stimuli from the outside is shorter, which means you are not lethargic. It's a state of very high alertness, but complete quietness, which is not usual in the other states of consciousness at all, because either you are active and awake, or you are restful but not awake. In this one, you are very awake, very alert, but completely rested. Now, this is called transcendental consciousness. And if this starts staying with you more and more, then you can live life on this basis of inner, peaceful, alert, awake state, yet very, very restful and very dynamic activity on the outside. And this combination of awakefulness with rest, and yet in a state of ability to act effectively in the outside, is a state of higher consciousness. And that develops to even more and more appreciation of the self, appreciation of the outside value. It's like broadening your awareness. You're able to take into consideration much more factors from the environment. And we see this in the nervous system through the opening up of the reserves of the brain, and through the coherence between the different parts of the nervous system, which means it's all the processors of the computer are working together in a holistic way. And that is what gives you this sense of alertness, wakefulness, sharpness, yet broad comprehension and ability to have proper situational awareness, which means you can see many, many factors even while you are concentrating on individual factors.
Beautiful. And on this point, Tony Garza wants to know, how often do you have to meditate to receive the benefits of transcendental meditation?
It's usually twice a day. That is the practice, 20 minutes morning and evening, sitting comfortably in a chair. So there is no preparation needed and no special thing. It's not a belief system. It's not a philosophy. It's a technique. That's why it's called a technique. So you sit comfortably. It's a mind technique. And then you learn how to allow your mind to dive within yourself and rest like this and get the results. So 20 minutes morning and evening. And from the very first sitting, you start experiencing a change and a difference. And as the practice goes, stresses are more and more released because of the deep rest that is gained. And the body naturally, again, has the ability to adjust itself and correct itself when it is given a chance. If you cut yourself, the body heals itself. You don't have to, of course, you have to make sure it's clean and the things are together. But the healing process happens from the body. We heal ourselves every day when we sleep, when we dream. All these are healing procedures. But it doesn't seem that they remove the deep-rooted stresses. What transcendental meditation has shown is that the deep rest that you gain and the quality of the deep rest that you gain during transcendental meditation removes not only the superficial fatigue, but also stresses that might have accumulated since childhood or are there for whatever reason, and then they are there in the unconscious and the subconscious, and they are disturbing us, but we don't have access to them. And in this technique, actually, we don't try to analyze them. So it's not a psychoanalysis kind of process. It's a personal do-it-yourself technique where the stresses are spontaneously released because the body gains deep rest. And when it gains deep rest, it automatically itself heals itself.
Wonderful. On this question of consciousness, are there other names? Stephen Rood wants to know, are there other names for transcendental consciousness? And are there other ways to achieve this transcendental awareness besides transcendental meditation?
Yeah, it's Satori, Nirvana, it's Samadhi in different cultures. And, it's being experienced by different people by chance, by seclusion or by prayer or this and that has been experienced here and there, and many people who have experienced this beautiful inner feeling of peace have given their lives to it and to try to experience it again. And so this technique, the advantage is a very simple technique. It's systematic, and you can get the experience in a repeated, reliable way, in a systematic way, which means there is a procedure and a technique to do it, and rather than leave it to chance or to moments of settling down, moments of one is really rested and very settled and inspired and the body's working well, and then there might be moments like that. So all contributes, all that are good things, good balance in diet, good sunshine, good activity, healthy living, natural living. All this helps in creating a better state where one can have a chance to experience this state of samadhi or nirvana or satori and like that. But this technique is simple and systematic, and that's why it's very practical.
That's perfect. Julia, our lovely host from Bastyr today, has a question for you. Julia, would you like to go?
Yes, we have some questions from students. How can we help patients establish a foundation of neurological health and awareness of consciousness? And related to that, oftentimes it seems that a patient might be hesitant or resistant to trying meditation or even breathing exercises for a variety of reasons. So what are some ways we can encourage patients or anyone who might be hesitant about meditation to give it a try?
People need to understand why it is necessary, and the fact that this is not something that is a belief or that is, because there is prejudice sometimes. People think I have to change my belief, or is it difficult to concentrate? my mind is so tired. My mind is jumping all around and it's not for me. Let me first cure myself, etc. So there is a need for education and explanation and awareness by giving information and scientific research and inspiration, and that it's easy, that it's simple, that it's helpful to the physical body also. And so by educating and showing the research and talking about it in a way that responds to the patient's need, that will help them to make this move to learn.
So if you would like, Dr. Nader, we can take one more question from the chat. And if you'd like, I think you do have questions there. But Carrie Bender was wondering from the chat, have there been any studies or does Dr. Nader know anything about the experience with children in dealing with ADHD, practicing TM as a therapy?
Yes, actually, one of the slides that we went through had ADHD, and it's really very, very effective. We can see the effects in the children, as well as in their behavior, in their ability to concentrate, and ability to work better and to settle down. But also it has been documented through the EEG changes that happen in those children. So yeah, absolutely. And one can learn the technique from the age of 5 already. There is a children technique up to 10, and then the adult technique starts from 10 years and on.
Perfect, thank you. And Dr. Sudi, I believe we're running up against a time restriction.
Yes. So thank you for your time, Dr. Nader, and a great presentation. I'm sure our med students really enjoy your talk today. We would like to congratulate you for successful launch of your book of One Unbounded Ocean of Consciousness, and that has been published as an ebook, and paper copy is also available. Please, everyone sign up for Bastyr students. There's a link to get a free ebook. So thank you everyone for joining the event, and have a really wonderful day.
Thank you, Dr. Bascota. Thank you, Julia, and everyone for having me. It's a joy.